Okay, so now we will start with the psychotic disorders. So all the psychotic disorders. So the main thing to remember, I think the easy way to remember is the basically the timeline and the symptoms. So all our psychotic disorders are we are diagnosing on the basis of the timeline plus the basis of the symptoms. So in all the DSM-5 criteria, the the main thing is like the duration and the in the like the symptoms present, and then also in the question stems, uh, usually they are giving like this, like they are giving some like risk factors and all those, but they are giving some symptoms and then the duration. So if that criteria is met, then we classify the disorder accordingly. So let's see what are the main disorders. So this is in the psychotic disorder, this is also one of the MCC objectives. So there are basically positive symptoms and then negative symptoms. So what are positive symptoms? Delusions, hallucinations with or without insight into pathological nature, grossly disorganized and abnormal behavior, and formal thought disorder. So these basically delusion, hallucination, thought disorder, and then disorganized behavior. These three are the positive symptoms. And what are negative symptoms of schizophrenia? Diminished emotional expressions, anhedonia, evaluation, and all this, like kind of apathy and flat face and like no emotions. So those are the negative ones, and delusion, hallucinations, and these are the positive ones. So what are delusions? These are basically fixed false beliefs that are not amenable to change in light of conflicting evidence. So the patient have a firm belief, kind of like a false belief, but that is the delusion. And what are hallucinations? These are perceptual experience occurring without an external stimulus, like he's like hallucinating, like seeing something, or visual or auditory hallucinations and all, like he can hear something, so those kind of stuff. But the delusion are basically the false beliefs. So now what are differential diagnoses of psychosis? So then there are like so many disorders, um, but like as I have said, basically it is the duration. We will see the duration and the symptoms. So the first one is brief psychotic disorder. So in the brief psychotic disorders, more than one positive symptoms of criteria A and less than 1 month duration, eventual full return to pre-morbid functioning. So there is no permanent damage, but the duration is more than one positive symptom, like these ones that we checked above. The like the maybe the patient just have hallucination or just have delusion, and all of a sudden this symptom happen, but the symptom is less than for 1 month. So then the criteria of brief psychotic disorder is met. Now the second one is schizophreniform disorder. So same schizophreniform disorder criteria A is met, like the actually this one is criteria A. Two or more of the following each present for significant portion of time during 1 month period. So because all of these like delusion, hallucination, disorganized speech, disorganized behavior, and negative symptoms, at least two are time period for 1 month. So at least one of these should be one, two, or three. So the first three, at least one should be met. Like maybe the patient have delusion or hallucination or disorganized speech. So one of these should be present. So that is basically our criteria A. But the duration is it is 1 to 6 months, because if it is after 6 months, the same criteria A, then the patient is schizophrenia. So in the question stem, they will definitely like mention something if the patient, I mean, they will not directly give like it is 6 months or less than 6 months, but they can like mention something like if the patient is now 30 years or like 25 years and this happened from high school or something, to know like about the duration. So then the main difference between phreniform and schizophrenia is the duration and then the criteria. And then what is schizoaffective disorder? So basically schizo is the psychotic and affective means mood. So then it is psychotic plus mood disorder. So that's how I remember it. So then there is criteria A plus major mood episode, whether it is depression or mania, but there is one mood episode is present, and this one is more than 2 weeks of psychotic symptoms without mood symptoms. So we will study it later in detail, but the main thing is schizoaffective is there is a mood and psychotic, and at least 2 weeks or more of psychotic symptoms without mood symptoms. So This is the main criteria, and it should be more than 1 month. Now the delusion disorder also more than 1 month, one or more delusion if hallucinations related to delusion theme. So one or more delusion is present for more than 1 month. Like the patient will be thinking, oh, the person is like going to kill me or like something like that, but that false delusion is present for more than 1 month. And then substance induced is like delusion, hallucination, onset during intoxication, withdrawal, and it resolves in less than 1 month without use. So this is basically related to the substance. And then secondary to mood disorders. Mood symptoms are dominant, delusions, and hallucination. Psychosis may be present only for the duration of the mood symptoms. So basically, these are all the psychotic disorders according to the timing and the duration. And then duration is they just three psychotic disorders. If it is less than 1 month, then we call it brief psychotic. If it is 1 to 6 months, it is schizophreniform disorder. And if it is more than 6 months, then it is schizophrenia. So the patient will be say, like doing like showing all the psychotic symptoms and everything, but according to the duration, the it can be changed, right? So this is also the differential diagnosis, like primary disorders, schizophrenia, pheniform, all that. Then there will be mood disorders with psychotic features, then mood disorders, all these personality disorders, then yeah, then general medical conditions, substance induced. So we will study all these in detail. So what is basic management of acute psychosis and mania? First thing is ensure safety of self, patient, and other patients. So this is the first thing if they ask in CDM or something. So if the patient is acutely psychotic, so the first thing we have to ensure the safety of the patient and the other. And then there should be an exit strategy, that is also kind of safety plan. And then decrease stimulation, the keep patients like calm kind of, and assume a non-threatening stance. And then intramuscular medications like benzos and antipsychotics often needed as the patient may refuse oral medication. So acutely agitated patient, we are usually giving benzos or antipsychotics. And then physical restraints may be necessary. Do not use antidepressants or stimulants. So this physical restraints is not like the first line therapy. First line therapy is like all these 4 or 5 things. The first thing is ensure safety of the patient. The second thing is have an exit strategy. And then the third thing is decrease stimulation. And then the fourth thing is assume a non-threatening stance. And then the medication, even the medications come like after 3, 4 things. And then the physical restraints and all those like are kind of last. So uh, this is basically the all the psychotic disorders. And I think I have one. Yeah, I have this chart. So this is kind of easy to remember. So schizophrenia, signs of illness for more than 6 months. Psychotic symptoms are delusion, hallucination, disorganized speech for more than 1 month. And then in the schizophrenia, what is the thing? Social occupational dysfunction. Like there should be a dysfunction in the daily life or whatever the patient is doing. That is also one of the criteria. We will read it. So, and in the schizophreniform disorder, what's happening? It is similar to schizophrenia, but except duration of illness is less than 6 months and more than 1 month. So the duration, schizoaffective is the psychotic plus the mood. So uninterrupted period of illness in which symptoms of schizophrenia and major mood episode occur concurrently during lifetime duration of illness, more than 2 weeks of delusion or hallucinations in absence of major mood symptoms. So that thing is important to diagnose the schizoaffective. So they will mention something like there will be only psychotic symptoms and there are like no mood symptoms for 2 weeks or more. So this is important to remember to diagnose this one. And then major mood episode is present more than 50% of total duration of. So basically mostly the patient is having mood episodes. So the psychotic episodes can be easily missed. So that's why it is important like to diagnose if there are any psychotic symptoms for 2 weeks or more, because mostly the patient will be having the mood symptoms. And then delusion, non-bizarre delusions for more than 1 month, and patients does not meet criteria for schizophrenia. So this is the delusion. Brief psychotic is the more than 1 day and less than 1 month. So may or may not be related to marked stressor. So this is important. Maybe the patient is completely fine. There is no marked stressor as in acute stress disorder, but he can show some psychotic behavior, right? So eventual full return to promoted level of functioning. So the important thing is here is the patient return to full functioning in less than 1 month. And then substance use, delusion or hallucinations develop during or within 1 month of substance intoxication or withdrawal, and etiology related to medication use, not better accounted by another psychotic. So basically, it is there will be history of substance use or misuse or withdrawal or something like that, and then it is in younger adults. And then psychotic disorders associated with other medical conditions, delusion, hallucination, and all these can be present in the delirium, other medical condition. And then major depression or bipolar disorder with psychotic features. Delusion or hallucination occur during a major depressive or manic episode. And then the last one is psychotic disorder not elsewhere classified. So all these are ruled out. Then psychotic symptom present but criteria for specific disorder is not met, and there is insufficient or contradictory information. So this is diagnosis of like exclusion kind of, because we exclude everything and then finally the patient still having the psychotic disorder. So that is basically the all the psychotic disorders. And then in the investigations, we are doing the relevant investigations accordingly, like CBC and LFTs, ECG, if clinically indicated. Then we are doing like, so what is the criteria for schizophrenia? So this is like the main one. So the first thing is like in these five things, two or more of the following, each present for significant portion of time during a 1 month period or less. If the patient is successfully treated, at least one of these must be one, two, or three. So, delusion, hallucination, and disorganized speech. So, there must be one of these symptoms present, and then disorganized speech and grossly disorganized catatonic behavior and negative symptoms. So, and then the next two are the disorganized behavior and negative symptoms. And then what is the criteria? Be significant portion of time, as we have seen, like more than 6 months. So continuous signs of disturbance persist for at least 6 months. This 6 months must include at least 1 month of symptom or less if successfully treated to meet the criteria one. So at least 1 month the patient should have these kind of symptoms to diagnose the schizophrenia. And then schizoaffective disorder and depressive or bipolar disorder with psychotic features have been ruled out. So it is important to rule out all the other ones and all these like the major depression with psychotic and all that to rule out. And then substance abuse, um, like it is not attributed to substance abuse. If there is a history of autism spectrum or like the other disorder, so that should be ruled out. So all these criteria are ruled out, and plus these criteria are met, then the patient can be diagnosed as schizophrenia. And then specifies types of episode, first episode, multiple, so depending on the patient's condition. And it is more male to female, it is both common, like 1 to 1 ratio. Mean age of onset female late 20s, and in midlife, and males mid 20s, so basically in young patients. And there is suicidal risk present. So suicidal risk is present in all the psychotic disorders as we have studied before. So this is basically the schizophrenia. And then etiology, it can be like multifactorial, environmental factor, genetic factor, and this dopamine hypothesis and all those things. So this is all the pathophysiology and like etiology. And then this is all the disorganized behavior, like different kind of disorganized behaviors can be catatonic stupor, catatonic excitement, ecopraxia, and all these definitions you can see from here, different types of. And then the comorbidity with the any psychotic disorders, the other comorbidity of the substance use disorder, it is like more than 50%, anxiety disorder, and all the other medical comorbidities. So these can be present. Now, how we will manage the patient? So the first one is biological and somatic. So acute treatment and maintenance. The first thing is antipsychotics. that are risperidone, ariprazole, haloperidol. So, and the clozapine is given if resistant. So, first line is risperidone, haloperidol, all these. And if it is resistant, then clozapine. And then this is the IM and long injectable, different kinds available. And then if the mood disorder is also present, then mood stabilizers can be given. The first line is lithium, then valproate, carbamazepine, anxiolytics, and the ECT, like the final one. And then maintenance treatment for at least 1 to 2 years after the first episode, and at least 5 years after multiple episodes. So if there are multiple episodes, then 5 years, and if it's like the only the first episode, then 1 to 2 years. And then psychosocial therapy, all the CBT is like the main therapy in all the psychiatry thing. So CBT, psychotherapy, and then community treatment and all the social skills training, housing. So these all should be given to the patient. And what are the good prognostic factors? Acute onset is a good prognostic factor. Later age of onset, shortened duration, female gender, good cognitive functioning, good premorbidic functioning, no family history, good response to drug, and good support system. So these are the good prognostic factors for schizophrenia. So the next one, schizophreniform, as we have already seen, it is basically more than 1 month, but it is less than 6 months. So that is the main difference between schizophrenia and pheniform. And then criteria A, D, and E of schizophrenia are met. So what were the criteria A, D, and E? The first one was two or more symptoms should be present, like from these delusion, hallucinations, disorganized speed, disorganized behavior, and negative symptoms. And A, and then D, schizoaffective disorder and depressive, like all other, have to be ruled out. And what is E? The substance abuse should be ruled out. So basically A, D, and E criteria should be met. And then the second thing is duration, and with or without good prognostic features, acute onset, and all this. So treatment is basically similar to the schizophrenia, and then the prognosis is better than schizophrenia, and then 2/3 progress to schizophrenia. So it is high chance that the patient schizophreniform disorder progress to schizophrenia. And then this one, brief psychotic disorder, criteria A1 to A4, D, and E of schizophrenia are met. So the same A, D, and E are met. No substance, no other disorder, and psychotic features like hallucination, delusions, those are present, but the timing is different. At least 1 day and less than 1 month. So then we call it brief psychotic disorder. So eventual return to functioning. So specify any stressors, postpartum onset, and current severity, and all this. So treatment is providing safe environment, secure environment, antipsychotic, and anxiolytic. So all the psychiatric disorders, there are like basically pharmacological therapy and non-pharmacological. So in non-pharmacological is mostly like the CBT or different, like providing safe environment and counseling and all those things. And then we start with the um, medications. So for the brief psychotic disorders, the prognosis is good, self-limiting, and should return to the normal function within 1 month. So this is one of its criteria. Because if it's not returning to 1 month, then carrying out to the other one, then it can go to schizophreniform, and then the other one. And now schizoaffective, as we have seen, schizo means like psychotic, affective means like mood disorders. So what is the DSM criteria? There should be major mood episode. So the patient have psychotic episode, but there should be major mood episode. And as we have seen before, these mood episodes are like more than 50%. So this is like the dominant feature of schizoaffective. And then delusion, hallucination for 2 or more weeks in the absence of major mood. So that we have seen before, this is the one of the criteria, that 2 or more weeks should be there should be no mood symptoms, but there should be delusion or hallucination, that is the psychotic symptoms. And symptoms that meet criteria for a major mood episode are present for the majority of the total duration of active and residual periods of the illness. So major mood episode. And if distribution, this is the same, like not attributed to any medical condition, not due to any substance. So that has to be ruled out. And then what is the treatment? because it has like the major mood episode. So that's why we are with the antipsychotics, the mood stabilizers are also given, and antidepressants accordingly if the patient having like depressive symptoms, right? So then antidepressants. And then non bizarre delusions involve situations that could occur in real life, being followed, poisoned, loved at a distance. Bizarre delusions involve situations that cannot occur in real life, like being kidnapped by aliens and all this. So the patient can have non bizarre ones and bizarre ones. So this is just the difference between these two. And then the next one was the delusional disorder. So what was delusional disorder? The duration was 1 month or longer. So there is a false belief or like delusion for 1 month or longer. Criteria A for schizophrenia is never met. That's why it is delusion. And hallucinations, if present, are not prominent and are related to delusion theme. And then the C, apart from impact of delusion, behavior is not obviously bizarre or odd. So the behavior is not that much bizarre, but there is a firm delusion is present. So if manic or major episodes have occurred, have these brief relative to duration of delusion periods. And this is the same thing, no substance, no other medical condition. This has to be ruled out in almost everything. And then what is the treatment? Antipsychotics, psychotherapy, and
Types. We missed the types.
oh, sorry. So the delusion types, these are the erotomanic, grandiose, jealous, pre-security, somatic, mixed, unspecified. I think there was like a sidebar that we have read before. So its definitions are written in the uh, those ones. And then further subtypes, there are bizarre content, type of episode, first episode, multiple episode, and then severity. So basically, there is like delusion present for 1 month or more, and then psychotherapy, antidepressants, and antipsychotics. These are basically the so I think these are all the psychotic disorders that we have done so far. So